Good afternoon all. I am Dr. Pawan Kumar Wankhede, Assistant Professor, Department of Pharmacology at Dr. D.Y. Patil College of Pharmacy. Today we learn about the topic anti-anginal drugs. So before start with the anti-anginal drug, you must understand the basics regarding the angina pectoris. Now, what do you mean by the angina pectoris? So angina pectoris is a pain syndrome. Syndrome means just a collection of you can say that the uh, uh, syndrome due to the imbalance between the oxygen supply and demand situation in a portion of a myocardium of the heart. Now you can see that the supply and the demand, why this angina or chest pain is occur? Because of the decrease in the coronary blood flow and the increase in the oxygen consumption. Now why there is a decrease in the coronary blood flow? Because of the vasospasm. Vasospasm means it is a vasoconstriction. Fixed stenosis means it cannot be changed. It is called as the fixed stenosis. And thrombosis, and due to that it decrease in the coronary blood flow. And why there is a increase in the oxygen consumption? Because there is a increase in the heart rate, increase in the contractility, increase in the afterload. Now how do you mean afterload? After the contraction, if the blood goes into the aorta and that particular pressure, it is called as the afterload. And preload, it is before the contraction of the heart, the volume, that particular pressure, it is called as the preload. Now we'll just detail. You must understand these two terminology, preload and the afterload. Now you can see this diagram. This is called as the preload because the blood it is goes into the heart and the before the contraction of the heart, and this pressure is called as the preload. Now after the contraction of the heart, it goes into the aorta, and this pressure it is called as the afterload. Understand? So you must understand these two terminology, preload and the afterload. So it is the volume of blood received by the heart, it is called as a preload. So it is just before the contraction of the heart, that particular pressure it is called as the preload. And afterload is, it is after the contraction goes into the aorta and that particular pressure, that particular resistance, it is called as the afterload. Now we move towards the types of the angina pectoris. Now angina pectoris are classified into the three types. The first one is the stable angina, second one is the variant angina, and third one is the unstable angina. Now what do you mean by the stable angina? This generally occur during the exercise. Okay, so this is occur generally exercise or due to the emotions or heavy meal or the coitus, and hence it is called as the stable angina. So stable angina is generally occur when there is a exercise. It is called as exercise induced angina. So due to that particular exercise, if you have some emotional state or if you have the heavy meal or during the coitus, it may causes that particular attack. Then it is called as the stable angina. Now we move toward the variant angina. As the name suggests, attack is occur even at the rest position or during the sleep. Hence it is called as the variant angina. And you can see that this variant angina, it is mostly due to the vasoconstriction, or it is maybe due to the with or without the atherosclerosis, and you pain even at the rest position. Now third one is the unstable angina. So it is due to the rupture of atheromatous plaque. Now you can see that in the blood vessel there is a atheromatous plaque, atherosclerosis, or that particular thrombosis is present, and if due to that, if it is a plaque, that particular plate attract the platelet, and there is a more platelet deposition is occur, and there is a progressive occlusion of the coronary artery. The coronary artery is totally blocked, and and hence it is called as the unstable angina. Now we move toward again the basics. You must before start with the any topic, you must understand the basics. Now there is you can see this in the diagram in the normal rest and even at the exercise condition. The conducting vessel. Now what do you mean by the conducting vessel? So it is a large vessels, or you can say that when oxygen and deoxygenated blood are supplied, these both are called as the conducting vessels. So it is the large volume, it is occupied by the conducting vessels. So you can say that the aorta, pulmonary artery, it is called as the conducting vessel. Now what do you mean by the resistance vessel? Now you can see that this is called as the resistance vessel. Small arteries, arteriole, capillaries are also called as the resistance vessel. This determine the peripheral resistance. So you can see that through the diagram, you must understand what do you mean by the conducting vessel and what do you mean by the resistance vessel. Now what happen in case of the classical angina? In case of the classical angina, you can see that during the exercise, flow not increase. Means during the classical angina, because you can see in the normal it is flow is increases, but in case of the classical angina, the flow it is not increases because of that particular atheromatic block. Now, in the case of variant angina means it related with the vasoconstriction. Now we can see that the variant angina flow it is decreases. So this is a very important to understand the meaning of conducting vessel and the resistance vessels. Now, what are the different target of the drug action? Through the pathology, or what you have to do, we need to decrease the oxygen demand. Yeah. So you have to decrease the oxygen demand, and you have to increase in the oxygen supply to maintain the balance. So what are the different targets? So you can see that you have to decrease the heart rate. Now how you can decrease the heart rate? You have to, because beta adrenergic agonist, it increases the heart rate. So you can block the beta adrenergic, you can give the beta adrenergic antagonist drug such as propranolol, atenolol in the treatment of the angina pectoris. Also you can use the because contractility also, if contraction increases, it increases the heart rate, and also it increases the oxygen demand. So due to that, you have to again use the calcium channel blocker for the treatment of the angina pectoris. Then you can use the dilator. So preload and afterload is the most important factor in case of the angina pectoris. In that, both preload and afterload is increases. So now in case of the angina pectoris, you have to decrease both the preload and the afterload. Hence, you can give the some organic nitrite or the calcium channel blocker. So these are the agents which decreases the oxygen demand. So you have to balance the oxygen demand and the oxygen supply. And in case of to increase the coronary blood flow, you have to use the vasodilator in the treatment of the angina pectoris. So understand that you have to use the vasodilator drug. You can use the organic nitrate, which is also a vasodilator, calcium channel blocker, and the beta adrenergic antagonist drug you have to give in the treatment of the angina pectoris. Now these are the classifications. So short acting glyceryl trinitrate, long acting isosorbate dinitrate, isosorbate mononitrate, erythritol tetranitrate, penta erythritol tetranitrate. So these are the called as the nitrate, or these are the drug which causes the decrease the preload and the afterload, and also causes the vasodilation. Now second target you already discussed in the previous slide, it is a beta blocker. Why this given? Because this drug decreases the heart rate, and it decreases the heart rate, it decreases the oxygen demand. So what is our aim? You have to decrease the oxygen demand. Example are propranolol, metoprolol, atenolol, and the others. Now next one is the calcium channel blocker. I already told that calcium channel blocker decreases the contractility. So again you have to use the calcium channel blocker to decrease the oxygen demand. So you can use the verapamil, diltiazem, nifedipine, felodipine, and the amlodipine, nimodipine. So these are the drugs which are the calcium channel blocker. Next one is the potassium channel opener, or the nicorandin. You can use in the treatment of the angina pectoris, and some other are the diparidamol, which is the coronary vasodilator, trimetazidine, ranolazine, ivabradine, and the oxyfidine. These are the newer drugs which are used in the treatment of the angina pectoris. Now these are the some important treatment of the important categories of the angina pectoris. So you can use the nitrate, as it specifically dilate the vein. So it is called as the vasodilator. It decreases the preload. Beta blocker, it decreases the heart, means decreases the cardiac work. And calcium channel blocker, again it acts on the artery and decreases the afterload. So these are the three important category of the drug which are used in treatment of the angina pectoris. Now we'll move toward the mechanism of the angina pectoris, mechanism of the nitroglycerin. So this is the nitrodilator which are enzymatically degraded into the nitric oxide. Now nitric oxide which is converted into the GTP is converted to the cyclic GMP. Okay. Now cyclic GMP it is important, and now this cyclic GMP, what happen? It inhibit the this phosphorylation of myosin light chain kinase. So you have to remember the term myosin light chain kinase. Now cyclic GMP it inhibit the phosphorylation of myosin light chain kinase. Now what happen? Why this phosphorylation is required? Now this phosphorylation is required because this myosin is bind with the actin, and it causes the muscle contraction. Now what happen? If it causes the dephosphorylation, instead of contraction, it causes the vasodilation. So what do we require? You require the vasodilation, or we require the decrease the preload and the afterload. So instead of vasoconstriction, it causes the vasodilation. I am again revise. So nitrodilator are the enzymatically converted into the nitric oxide. Now nitric oxide is specifically it convert the GTP into the cyclic GMP. Now cyclic GMP it inhibit the phosphorylation of myosin light chain kinase. Now this phosphorylation is important for to bind with the actin, which causes the muscle contraction. Now why? Because it inhibits the phosphorylation, instead of contraction it causes the vasodilation. Now cyclic GMP also indirectly inhibit the entry of the calcium ion channel. Now you can see that entry of the calcium ion channels also decreases the contraction, and instead of contraction it causes the muscle relaxation. So you have to remember the two terminology: nitric oxide, cyclic GMP, myosin light chain kinase. Now you can see this calcium is bound with the calmodulin and it causes the muscle contraction. Now, what are the different pharmacological actions of the nitroglycerin? So, nitroglycerin, it most important exerted on the muscular muscle. So, it dilate the veins more than the artery. So, what happens when you dilate the veins? It causes the peripheral pooling of the blood. So, decrease in the venous return. Venous return means from the superior vena cava or inferior vena cava. Because the if it is more the blood flow, then it causes the more the preload on the heart. So because of the dilation is occur, it causes the peripheral pooling of the blood and decrease the venous return. And due to that, it decreases the preload of the heart is decreases. So end diastolic size and the pressure also reduces, and that decreases the cardiac output. So what our aim? You must decrease the cardiac workload to decrease the demand of that particular, and due to that, it decreases the oxygen demand and increases the oxygen consumption. Next one is the afterload reduction. So nitrate also produces some arterial dilation. Now you already told that arterial dilation afterload, because of the arteries dilated, this afterload it causes the total peripheral resistance. So what do you mean by this total peripheral resistance? It is a resistance occur when there is a forcefully blood pulling into that of the aorta. Now, because of it causes the dilation, it decreases the total peripheral resistance, and due to that, it decreases the afterload of the heart. Now, third important pharmacological action is redistribution of the coronary blood flow. Now, what happens? This nitrate it relaxes the bigger conducting coronary arteries than arteriole or the resistance vessels. So, specifically dilate the veins, and it causes the redistribution. What happens? There is a ischemia is occur, and you must understand that it must be a redistribution of that particular coronary blood flow to the ischemic area where blood supply was not occur in the angina pectoris. So, third important pharmacological action is the redistribution of the coronary blood flow. Heart and the peripheral blood flow also dilate the cutaneous over the face and the neck, and it causes the flushing, redness of the skin, and meningeal vessel, which causes the headache. And this pharmacological action is mostly related with its adverse effect. You can see the adverse effects are flushing or the headache are the other side effect. It also dilates the some bronchi, biliary tract, esophagus, and effect of intestine are variable and insignificant. Now this is the adverse effect. So these are the mostly due to the vasodilation, and you already discussed that there is a fullness of the head, stomach headache, some degree of tolerance develop after the continued use, and flushing. There is a redness of the skin, weakness, sweating, palpitation. There is awareness of heartbeat, dizziness just straight before the sleep, fainting, just like a falling the blood pressure, or and erect posture and alcohol acquaintation. These are the symptoms or the adverse effect of the nitroglycerin drug. So this is all about the topic about the topics important topic of drug acting on the heart. It is the nitroglycerin, and we discuss about the it's what do you mean by the angina pectoris, what are the types of angina pectoris, what are the different target of the drug action of the angina pectoris, what is the mechanism of the nitroglycerin, pharmacological actions, adverse effect, and uses of the nitroglycerin. I hope all the students have understand this topic, and we will meet in the next lecture. Thank you. मॅडम झालं म्हटलं माझं, फक्त स्टॉप नव्हतं होतं, स्टॉप स्टॉप करायचं. तेवढं क्रॉप करता येतं ना, सेव्ह होईल ना. काय करू, कॅन्सल. हां होईल ना, सेव्ह 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 होईल ना कुठे हे.